Hello, in this video we will discuss about the obesity, their process and physiology and liposuction process through machine. We will understand about first of all the obesity, what is the obesity and type of obesity. So the two type of obesity, let's begin to understand. So in this way here is the fatty person, the female, the physiology of obesity we will discuss first. So that due to the obesity, which that is desire of food increase due to several process, but in this way here we will understand about the general mechanism. So that pancreas stimulation due to the food, and when we will eat the food contain sugar, and this will lead to drastical decrease the glucagon while the insulin will increase due to the glucose. So when glucose will increase in our blood, so the insulin will produce more while the glucagon will inhibit, is known as the anabolism. So this anabolism is basically the insulin insensitivity in muscle, while the insulin sensitivity more in the adipose tissue for the pre-diabetic person. Later on will decrease also the adipose tissue. So the lipogenesis will be increased due to the glucose uptake through adipocyte triacylglycerol formation, and the muscle insulin sensitivity will be decreased, so the GLUT channel will decrease in the myocyte. So the insulin sensitivity will decrease. That is why the muscle will not uptake sugar, but the adipocyte will uptake for the normal hyperglycemia to the hypoglycemia. So in this way, the when adipolysis will not occur, so the leptin decrease, adiponectin and FGF21 will decrease. So this FGF21 will decrease, adiponectin decrease, leptin decrease will lead to a positive effect of hunger increase, and in this way the hunger will increase will lead to decrease hypoglycemia, will again trigger the eating phase, and again hyperglycemia to hypoglycemia again, and the triacylglycerol decrease in the blood while the adipose tissue uptake and produce more triacylglycerol, lead to low density lipoprotein increase in the blood, while the high density lipoprotein will increase in the blood and the glucose will decrease, so the hypoglycemia. So the pre-diabetic person will lead to hypoglycemia. So let's begin to understand the skin of the fatty person. This skin is basically contain different areas, so here is we can cover that different layers. So the uppermost layer is the epidermis, so remember, and here is the innermost layer is the hypodermis. Between both layers the dermis are present. So this is the epidermis, and this is a sebaceous gland which that is bound with the hair for nourishment of the hair shaft and shining, to produce shining, and that is the side note to understand. So this is the dermis, and this is the hypodermis. This is the hypodermis, and this is the fascia. Hypodermis contain adipose tissue. It will increase. So here is the raphine and pacinial corpuscles, and this is the fatty layer, as well as the tactile corpuscles. So this is the adipose tissue. Remember, this deposition of adipose tissue due to the adipocyte uptake of glucose. When glucose will uptake to convert triacylglycerol as a stored energy, while the glucose will not uptake through a muscle, so that is why the muscle will decrease due to the insulin insensitivity in muscle. So this is the papilla of hair, which that is nourished through a blood circulatory system, so a vein and artery, and this is the erector pili muscle, which that is used for the goosebump for preservation of heat during the cold weather. So here is the peripheral adipogenesis will occur, the peripheral obesity due to the subcutaneous fatty layer formation. So anyhow, let's begin to understand the peripheral effect. The obesity will lead to weight gain, difficult to breathe, difficult to exercise, frequent hunger, more sugar desire, and gain weight to cause joint pain. So this is the process, and this is the peripheral adiposity, adipocyte development. So in this way, you should need to understand where leptin will decrease, so the ghrelin increase and adiponectin decrease, ghrelin increase lead to more hunger. So anyway, this is a smart person, but it contain a fat in the visceral area. Visceral mean inside of the abdomen. So here is the abdominal, ventral and dorsal cross section of the smart person. But this is the visceral adiposity, the visceral obesity. Here is the abdominal fat and heart visceral fat which that cover the lungs, heart and digestive system will lead to cause uh, uh, many defect, many disease. So the visceral fat far dangerous than uh, peripheral. So let's begin to understand. Here is the heart attack, heart disease, type 2 diabetes, blood pressure increase, and stroke, breast cancer, and colorectal cancer, which that is all is the visceral obesity effect. And this is more dangerous and cause heart attack. But the peripheral fat is not too much dangerous because it is a peripheral part of the body. So in this way, let's begin to understand the liposuction can be only peripheral fats, not a visceral fat, because it is hard work to remove the fat in the visceral. So the visceral fat can be removed through surgery. So this is the liposucker machine, which that contain a collector jar, which that collect the adipose tissue, and the speed of sucker rotor are present, and this is the sucker and needle and handle, which that will inject into the skin, into the subcutaneous layer to remove the fat. So let's begin to understand. The first is here is you can understand this is the removing through sucking of the adipose tissue, but in this case also the other tissue and the blood vessel will damage also, so remember. And in this way here you can see this the second one is basically the removing more and more and change the angle of the sucker needle to remove with a different area in the peripheral region. So important thing you should need to understand, the visceral fat basically in the abdominal region can be removed, but where the heart and other area can be removed through surgery. So in this way here you can see the risk factor, the liposuction injury, rapid weight gain, appetite increase, low blood glucose and infection chances increase, low blood pressure. So this all thing is basically obesity, and the liposuction process can be remove the fat. But the increase of the appetite due to the removing of fat will lead to again regain the fat, and that is the basically the diet conscious person can remove through a diet plan, intermittent fasting. So next video we will understand about the intermittent fasting.